بسم الله الرحمن الرحيم. قالوا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. All the presenters, Assalamu alaikum.
Walaikum salam.
I'm Dr. Ahubacha, Associate Professor in the University Institute of Radiological Sciences and Medical Technology. I'm very grateful to all the participants, including my teachers, my students, my colleagues, and specifically to the organizers of this event who allowed me to present the abstract of one of my articles entitled Clinical Significance of Twinkling Artifact in the Diagnosis of Urinary Stones, published in a journal, the Ultrasound and Medicine and Biology. The authors include myself, Dr. Ahubacha, my wife, Iqra Manzoor, my supervisor and mentor, Professor Dr. Saeed Amir Gilani, and Dr. Majid Iqbal, who have already presented as abstract. So I'll try my best not to let you bore. And you'll enjoy, inshallah, these 15 minutes with me, but I expect you will be attentive to me in these 15 minutes. So first of all, urinary stones are urolithiasis, one of the potential cause of clinical emergencies. Sometimes it leads to a number of clinical complications, ranging from urinary tract infection to end-stage renal disease. In human beings, urolithiasis has been one of the oldest known clinical problems. The history of urolithiasis goes back to the ancient Egyptian and Mesopotamia. With the development of medical sciences, numerous cutting-edge technique and treatment plans are required for the treatment of urolithiasis. The accurate diagnosis, size, and location are important for the selection of appropriate treatment plan. Ultrasound as a modality has been used for decades in the diagnosis of urinary stones. In spite of the fact that urolithiasis has been used in the diagnosis of urolithiasis for long, but there are a number of limitations as well. Relatively low contrast resolution, limited field of view. Some of the inherent artifacts and operator dependency are the most pronounced limitations of ultrasound. The accuracy of ultrasound in the diagnosis of renal stone is too good, but it is poor in the diagnosis of ureteric stones. The sensitivity of ultrasound in the diagnosis of ureteric stone is nearly 46%. So the application of color Dr. Twinkling artifact caused by urinary stone is not only useful for the confirmation of large stones, but it is particularly important in the diagnosis of those small stones less than 5 mm size that can easily be messed with the help of conventional grayscale sonography. To determine the clinical significance of twinkling artifact in the diagnosis of urolithiasis, we include 1,350 individual patients, including 499 females and 851 males, and about 6 years at Gilani Ultrasound Center, Lahore. All the participants were divided into 2 groups of equal size and followed for confirmation. And this group was termed as disease group. Similarly, a group of normal volunteer was recruited and control group for the comparison. All the individuals who were not accessible to be followed were excluded. We used AIM guidelines for the abdominal sonographic examination, and SPSS software was used for the evaluation of the data. And all the participants, 663 patients had stones at different levels of the urinary tract, including 213 stones at the level in the kidney, 133 in the proximal part of the ureter, 130 at the ureterozacal junction, 61 in the urinary bladder, 57 at the leg crossing of the ureter, 45 in the mid part of the ureter, 24 in the prostatic urethra. And this is the graphical representation of the different location in the urinary tract having stones, so the maximum number of stones are present there in the kidney. This is the comparison. If someone is interested, he can take picture of it, and later on he can contact me or discuss with him. According to grayscale sonography, confirmed cases, the sensitivity of grayscale ultrasound was 57%, as previously discussed by the speaker. The specificity was 96%, and positive predictive value 93%, negative predictive value 70%. But with the implication of twinkling artifact, Doppler twinkling artifact, the sensitivity was increased to 97%, the specificity to 100%, positive predictive value to 100, and negative predictive value to 97%. And here you can see this is the graphical comparison of the grayscale sonography and twinkling artifact. So, the mechanism of the twinkling artifact is a little bit tricky, but I have spent a lot of my time on this slide. That's why I'm going to present it in front of you, although I know very few will know about it. But if someone have any confusion about it, then he can contact me. I'll tell him and guide him in detail that how the twinkling artifact can generate. So the sound waves were generated by the transducer. Many were they were reflected from a rough surface reflector. Then the reflected sound waves having jitter, they have phase difference, and that phase difference is taken by the machine, the quadrature phase detector, a special component in the machine which calculate the difference in the pulse and the echo. They take it as a Moyne reflector, and that's why it will generate a twinkling artifact. Some of the ultrasound images of the twinkling artifact are over here. Here you can see. These are the twinkling artifact. In the first image here you can see this is a 4.5 millimeter stone which have no shadow on grayscale sonography, but on color Doppler there is a twinkling, and with the help of that twinkling artifact we can diagnose it. Similarly, there is another stone which have very faint shade because there is a strong reflector behind the Their stone, it is at the uretrovesical junction, but whenever we apply color Doppler in it, it has a very fantastic twinkling artifact. The same way, here you can see there is a stone in the ureter, so you got hydronephrosis in the kidney, right kidney, and whenever we followed it, there was a stone at the right ureter, in the right ureter, although it had no shadow, but with the help of twinkling artifact, you were able to differentiate. Similarly, there is another stone in the ureter. This is another stone at the uretrovesical junction, and this is a stone in the prostatic urethra, which is very precisely detected by the twinkling artifact. So, I think it was enough for today. If anyone have any question related to twinkling artifact, so they can ask. If I can answer this time, if I was unable, then we'll try our best mutually to study more. Any question?